Contraceptives can become effective as soon as they're started or as soon as they're inserted, depending on what type of birth control that we're talking about, based on when it is within a woman's cycle. So if a birth control pill, whether it's a progesterone-only pill or one that contains both estrogen and progesterone, is started during the first 5 days of a woman's period, she does not need any backup method, and it will become effective right away. The same goes for the implant in the arm, as well as IUDs. If they're inserted within the first 5 days of a woman's period, she won't need any backup. So for any of those forms of birth control, though, if they are inserted or started, if you're talking about a birth control pill, if they're started after the first 5 days of a woman's cycle, she'll need to use backup method, mostly meaning a condom, for the first 7 days in order for it to be effective for her to not use any secondary type of birth control. Your body really won't give you any sign that you're not contracepting, even if you think that you're contracepting by being on a birth control pill. So that means, you're on the birth control pill and maybe you forgot your pack at home and you're on vacation, so you've now gone 3 or 4 days without it, or you've just forgotten even a day or two, and there's no real sign that you're going to have that you're not contracepting. So the most important thing is that if you're trying to prevent a pregnancy, you know what your resources are. If you are on the pill and you forgot your pills at home and don't have access to them, use condoms if you're trying to prevent a pregnancy. If you have your pills on hand, you can always take that pill as soon as you realize that you missed it and get back on track, but use condoms for a couple days, again, for that extra prevention. Now, of course, with that, you won't get the protection that you do from sexually transmitted infections or exposure to other conditions if you're not using a condom. So if it's a new partner or someone that you're not quite sure of in terms of protecting yourself against infections such as HIV or gonorrhea, chlamydia, it is always best to use a condom, in addition to any other type of birth control that you might be on.